Hello, hello, hello. Thanks for joining us. Good evening, everyone, and welcome to the show. Thank you for joining us for this special edition of Talk with Tasha. We are starting an hour early and cutting our runtime in half in order to let you all, myself included, tune into the mayor's State of the City address starting in just about 30 minutes. The mayor was slotted to give the annual address at its usual time earlier this spring, but as you know, a few things popped up and disrupted some schedules. So, given all that has happened since then, I highly encourage everyone to tune in and find out what my colleague, the mayor, thinks about the current state of Austin. You can catch that streaming on the web at www.austintexas.gov/ATXN. For Spectrum or Grande users, it's on channel 6 and channel 99 for folks who have AT&T Uverse. So, given that we have limited time today, let's just jump right into it. Last week, the United States passed the grim milestone of 150,000 deaths related to COVID-19 since the year started. Here in Austin, the surge in infections we experienced earlier this summer has begun to recede, though there's evidence now of another bump. As if we haven't been dealing with enough collective anxiety, all this is happening with the start of the school year just days away. Here in Austin, and in fact, right here in District 1, we have an invaluable resource when it comes to grappling with this pandemic. UT's Dell Medical School has attracted an army of top-flight medical professionals to our community. I am very happy to have one of them join us tonight to share her depth of knowledge. Dr. Rama Thyagarajan is an infectious disease specialist and assistant professor in the Department of Internal Medicine at Dell Medical School. Thank you for joining us.
Thank you very much for having me. And I want to thank all your audience for tuning in here.
Thank you. So there's so much to talk about, and we have sort of an abbreviated time. I think a lot of folks know generally, what our concerns are. A lot of folks have heard us talk about COVID-19, but I'd really love to get your perspective, both as an infectious disease specialist and as a person, working in this space right now. It's really painful to think about, but we're almost 5 months now from the point when this pandemic really started to upend our lives in Austin. When you were in medical school, did you ever imagine that anything like this could happen?
No, this is the first large-scale pandemic that I experienced. In 2009, we did have influenza cases all over the country, a novel strain called the 2009. So I did have some experience with this, but not to this extent. Certainly, we've read about pandemics and mass casualties are not new to the world. I mean, everybody knows about the 1918 pandemic, and prior to that, there's been cholera pandemics and, plague pandemics throughout history. But this is the first that I have seen. And despite how you read about it, it's hard when you go through it for all of us.
I really appreciate that. And I really appreciate also that, you recognize that it's difficult for everybody. I think a lot of folks maybe don't understand that it's difficult for everybody, from, folks who are not infectious disease specialists, who are really just trying to figure out how to work around their employment shortages and childcare shortages and how to manage family and everything. So it really is difficult on all of us. And I like to, remind everybody that we're all in this together. So for a moment there, it looked as if the virus was about to test the limits of our regional hospital capacity. We heard a lot from Dr. Escott and some of the other professionals that really gave us some graphs and some forecasts on what that would look like. What are some of the more surprising experiences that you're hearing from your medical colleagues who are working in hospitals across the area?
I don't know if I would call them surprises, but I think one of the things that we come across is, it's a surge that we see. We think things are okay, and then people start, especially in New York and Detroit, New Orleans, earlier during the pandemic, we saw cases just piling on, people that are okay for some time and then getting on a ventilator, ICU, staying in the ICU for days on and passing away. I don't know if I would call it a surprise, but even in the healthcare community, as doctors and nursing and other health professionals working, it's hard for us to see patients get seriously ill and pass away. So that's one thing I want to share. And the other thing that's been hard for us is, when because of the pandemic, visitor restriction, families are not able to be with their loved ones at end of life. And that's been really difficult in healthcare. Certainly, the other thing is that we're continuing to learn about this disease now that we've had the COVID-19 virus globally and nationally. We're learning about all the persistent symptoms, or we're not really sure about how long it lasts. There are some people still experiencing fevers and difficulty breathing and tiredness and inability to smell. So those are the things that we're learning. Again, we're continuing to learn about the disease. I think none of this is it's really a surprise, but it's just the experiences that we're all going through in healthcare.
Yeah, I think that's one of those things that you really appreciate about scientists, right? That sort of perpetual curiosity, always learning more. There's certainly never an end to your acquisition of knowledge in that field. So I really appreciate that, y'all are learning more, and that as this thing evolves, you're able to really just help people better. I've thought about that, what that looks like with families not being able to be with their loved ones. I bet it adds an additional layer of, people talk about bedside manner, but I bet it adds that additional layer of responsibility when you sort of have to fill that role for families and people who are, transitioning from Earth. So we really appreciate all that you all do in the profession. I understand that. I'm sorry, did I miss something?
No, I was just saying hospitals try their best to engage families and, have them on FaceTime and have some last discussions and having to see their loved ones and bring some visitors on a limited basis. But it's still very difficult and traumatizing for people going through it.
Yeah, I can certainly imagine. Well, I can't imagine. I really can't. So I understand that there are more than a few people out there who may be deferring a trip to the hospital for routine or even emergency care out of fear of contracting COVID. Is there a valid fear? And if not, what are hospitals doing about that? And how do we really get the message out? We want to make sure that people are getting accurate information as much as possible.
I'm really glad that you're asking me this question. I think this is a very relevant question. If we had an outbreak that would last only 2 weeks, we really don't have to, maybe we just hunker down like we did, we stayed at home, kind of postpone things for 2-3 weeks. But now we're in this for a long run. We know that child vaccination rates have gone down significantly. Maybe I think I read somewhere that Texas is only vaccinating 44% of their children. So think about measles and other contagious illnesses. So kids need to be vaccinated. And in regards to adults that need to take care of their chronic illness, diabetes, high blood pressure, heart disease, any health condition, they really need to seek care. And people experiencing emergencies. I think the biggest damage is really people experiencing serious emergencies like heart attacks, strokes. People are not seeking medical care because they're afraid to come to the hospital. So these are the spectrum of illnesses or need for medical care that I want to make sure people understand. Hospitals and clinics are well prepared. I'll maybe just touch upon hospitals. In the hospital, as you enter the emergency room, there's really people are screened for symptoms and separated out for COVID and non-COVID diagnosis. They're in different areas. And most hospitals are testing everybody who are getting admitted. And healthcare workers are taking all the precautions. You cannot enter, as we all enter the hospital every day, every shift. We are asked for symptoms and our temperature is checked. If we have any symptom, we have to go home and get tested. So we're really not allowing any healthcare worker who's sick. We're screening all the patients, and we're limiting visitors because we don't want visitors bringing in cases or disease into the hospitals. And on top of that, we have very extensive disinfection protocols. So we do pretty much everything and anything that we could do to protect ourselves. And certainly the masking is a requirement among all healthcare workers, including break rooms, cafeteria, outside of people eating or taking their medications or staying in their own personal office, they have to mask. And similarly physical distancing. So everything that's required, I think it applies. And this applies to pretty much all area hospitals, I would say, nationally. So in the clinic, very similar recommendations really of masking, universal masking. Patients, when they enter, they have to mask, and distancing, and not allowing people to sit in the waiting area, and screening for sickness by telephone. Now, if some people may not be able to go to the provider, many, if not, I would say most providers are doing telehealth. So I think this is an excellent opportunity for people to call their provider and have a telehealth visit and get their needs addressed, get their blood tests done, medications refilled, so their chronic health conditions are properly managed.
I appreciate that. And I think you might have answered another question that I really wanted to ask you. And, because it's a mess to think about. Somehow it's become political fodder. It's one of those things where, you think you can't argue with science. You think you can't argue with medical professionals and scientists, but people will do it. So I think you answered my question, but I'd just like for you to be able to answer for folks who are curious. There's a significant chunk of people who really still just don't think masks or even social distancing are necessary. Do you, in your expert opinion, believe that there's any truth in the lack of necessity around masking or social distancing?
Masking and social distancing, in my opinion, as an infectious disease physician and an infection prevention expert, I believe are the key to prevention of disease. I mean, if you cannot stay home, and most of us, we cannot stay home for months on in a pandemic. If we cannot stay home 24/7, those are the two important precautions or infection prevention practices that I believe will help us reduce our risk. The risk to each one of us is cumulative. As each day goes by, the more we're out in crowded places around somebody who may be sick and not know about it, or may not be sick and still have COVID. So we have to protect ourselves from getting the disease from them. So masking and distancing is key. I think, after learning from the pandemic early on, I think there was some question whether the public need to be masked. This disease we're learning more and more about the transmission. At this time, we're pretty certain that most of the transmission can be reduced by masking and social distancing. And I'm very confident, and I practice that, and I strongly encourage. And as I said, hospitals, it's a mandatory practice. It's not optional for us.
Thank you for that. I actually have another relatively difficult question. I believe it's difficult because it's a moving target. It feels as though there's no definitive answer to the question just yet. But, myself, I have school-age children. I know, my friends, my neighbors, a lot of my constituents are asking this question. As we are talking about sending kids back to school or, us heading back to the office, my team and I haven't been working from City Hall since March. There are a lot of sets of nerves on edge, even with masks, even with distancing. Are these places safe? Is it safe to ride the bus? What locations and sites do you see as places that are highest risk of infection?
There is community prevalence in Austin, and globally, I mean, nationally, US has cases. There may be pockets that are less, pockets that are more. You could look at, for folks that are tuning in that are outside of Austin area, you should really look at your local map, and your public health officials look to them to see what the cases are. But I would presume here in Austin that there's extensive community spread. Some of us are able to take cars, some of us are able to work from home. If you're able to work from home, I think, and if you can do it well, you should. Same thing. I mean, there are some of us are essential workers, healthcare workers, people that work in grocery stores, bus drivers who have to get out there. Then I would say take all the precautions that you can. For example, if somebody is riding a bus, I would say make sure you have the hand hygiene, some alcohol with you, clean your hands frequently while you sit there, and mask, and distance yourself as much as possible from, you don't have to sit close to somebody because you do not know who has the virus. If you can avoid the bus, if it's a short walk up, I mean, I know it's hot out there, but if it's in the morning or late in the evening, you're able to walk half a mile, you get some exercise. And so I think it's good. But if you can work from home, it's the best. Same thing with schooling. I know we may be over time, but with schooling, I think it's a polarized decision. I mean, I see both perspectives. I see parents and children that need to get the education, all the other benefits that kids that go to schools get in regards to other programs, support with food and, other services. And I also see the public health perspective of outbreaks and spread of infection to teachers and outbreaks. So I think the decision needs to happen at the school district level in close collaboration with public health officials. CDC has clear guidance in regards to how to manage, getting kids back to school. If that is a decision made by the school district, and clear recommendations in regards to what needs to be done.
I really including the fact that you recognize it's nuanced. It's no easy answer, right? It's a tough call to make. And I think, while I recognize that, we're sort of limited on time now, I have one more question that I'd really like to ask you. In your opinion, how does this play out? Do we keep waiting it out with partial shutdowns and occasional spikes until the vaccine comes along? Would a brief, full shutdown be effective? Given, what we've been able to observe and what you all have been able to learn thus far, what do you see as the future of this situation?
I think the disease is widespread in the U.S. That a shutdown or, kind of hunkering down and staying at home is not going to be effective because there's so much disease in communities and states. There's going to be one or two people that come out and outbreaks will happen. So it's unlikely that we're past that stage where we can completely eliminate cases like some smaller, some countries were able to do. I think there is continued research. There's a lot of vaccines that are, there's very fascinating and, I would say optimism in regards to available vaccines and trials that are going on. We'll have to wait and see. As the CDC and Dr. Fauci talk about, we're hoping that, including me, we're hoping that we'll have something in late December, early 2021. In the interim, I think we need to be responsible. I mean, we're all in this together. I think all of us need to practice simple, basic, essential infection prevention practices like masking, social distancing, hand hygiene, staying home when somebody is sick, and even at home when you have symptoms to separate yourself from others. And if anybody has symptoms, they should get tested. And employers should really be supportive of employees who may not be able to, if they are sick, that they should get the sick pay. And, that would also help people stay home and, they'll protect not only their families, but everybody in the community. So we have to kind of hold on to this and do everything right to avoid large outbreaks and spread of disease till we have promising treatments, drug treatments, and vaccine treatments.
That's really good information, and I think it'll help people to make the most informed decisions possible. I know I said that was my last question, but I might have told a small white lie. I have one more question. So we can't talk about this pandemic without talking about the disproportionate impact it has, and the disproportionate impact it's been having on certain historically marginalized community, particularly our Latinx neighbors and African American folks. So I'm curious, from your position as a medical professional, and this sort of leads us into our next guest, because this is some of the work that she and her organization are doing. What's your perspective on how to reach residents?
I think the media has been very helpful. I think that's important to reach out and garner the support of the media, and also reach out to community and faith-based leaders of the Latinx community, African Americans, people like you. I'm glad that we have an opportunity here to reach out. I think you have to make sure it's easier to test people. I think people need to be educated and know about the symptoms of disease and know the science behind why we are saying what we're saying, make sure people understand what we're talking about, and to know the simple symptoms, how disease spreads without confusing them, giving them a consistent message. And also it's important to make people, make it easy for them to get testing, like, mobile testing. I think providing free testing, at home testing, having a bit availability of free testing on the weekends, late in the evenings, whatever it takes to get people tested. I think in some communities, there's concern about, deportation. I think we really need to work on alleviating people's fears, what are understanding what the barriers are, try to alleviate that, and reach out and embrace the community and help them out. As I said, we're in this together. We can't, not some of us doctors alone can't do it. Community leaders alone can't do it. We all have to do it together with the support of the public and the society.
That's a fantastic way to close. Thank you so much for your time this evening, Dr. Thyagarajan. I really appreciate you joining us. And I would like very much to be able to, if people have, questions in the future, I'd love to be able to bend your ear and get your advice on what's the best way to respond to people's questions and concerns. But in the meantime, thank you for joining us. And I hope you have a good rest of your evening.
Thank you very much for the opportunity.
Absolutely. It was a pleasure. All right, y'all. So this COVID stuff is serious business. And like the doctor said, it's up to all of us to keep it under control. There's one more guest that we have tonight who's going to be helping us do that. She's the founder of Central Texas Allied Health Institute. And I'd like to bring her on to talk about what it is that they're working on and how they're going to be able to help us as a community move forward in a way that's preemptive, where we're able to, and then respond to some of the need. We have Dr. Jerica Hockaday joining us. Hi there.
Hi, Natasha. How you doing? Good evening.
Doing real well. Thank you. How are you?
I'm doing well.
Fantastic. Well, thank you for joining us. I really appreciate it. So you'll have to forgive me if I fangirl a little bit, but I saw y'all in the media today. I saw you on the news. So can you tell us a little bit about Central Texas Allied Health Institute and what it is that y'all are working on, and then maybe close that off with why were y'all in the news today?
Gotcha. Okay. So we the purpose of Central Texas Allied Health Institute is twofold: to both increase and diversify the healthcare workforce here in Austin. And we specifically target folks in the communities of color and underserved communities because we need a lot of that here. We need a lot of diversity in our healthcare workforce. I'm among a handful of African Americans in that, and I've been here 20 years, and I'm about ready to change that because we need to have some better outcomes for our African American and Latinx communities, and that's what we're about. We were in the news today because we have started started 3 short-term programs, 4 and 5 week programs to help folks who have been laid off from the pandemic or just not working at all and want to get into the fight to help us fight back COVID-19 and get it out the door, because we're all about tired of it, I'm sure.
Right.
So folks that are interested in getting into one of our short-term programs, we have a patient care technician program that's 5 weeks. We have 2 4-week programs, EKG technician and a phlebotomy technician program that folks can enroll for right now and get involved and get us in the fight and help fight back COVID.
Would you mind telling us, so we can make sure to list it in the comments? Oftentimes our folks, they find out information either during or after because we're able to list it in the comments. How do they get in touch with you, number one? And then another question I have is, I'm certain that people are going to be asking about their credentials. Like, what do they need to be able to provide for you? What makes them eligible for the programs?
Okay, so they need to have a high school diploma or a GED and a willing spirit. That's about it.
Okay.
They can go to our website, ctahi.org. That's ctahi.org. You can call, you can email, anything you want to do, and any way that you're able to. And all the information is there, and they can get online and contact us, and we can get in touch with you and start the enrollment process.
That's awesome. Thank you so much. Let me ask you this, so given that you recognize there's some disparities in terms of representation in the healthcare space in the city of Austin, outside of, if if and when we get past COVID, how do you see Central Texas Allied Health Institute helping us to, like you said, to fix that?
I think it's going to be a long slog to get us where we need to be, because we are really behind. We are working on a healthcare workforce that I saw in the 1990s. So it will be no shortage of work to not only increase our workforce, but also diversify it at the same time. We used to have a 2-hospital system here. Now we have 3, plus we have all sorts of acute care centers and those types of things. And our population is growing. So we have a lot more population of folks than when I first moved to Austin. And those folks have to be serviced and their families have to be serviced. So I don't think that our healthcare workforce training is going to be going away. I actually think because of the COVID, I think not just in Austin, but nationwide, people have never known. And I think it's because of us living in Austin and being so inundated with tech. But the number one field in the United States is healthcare. The jobs are stable, as you can tell. So I don't think that we're going to have any shortage, and it's not going to run out anytime soon. We'll definitely be needed.
That's awesome. And I really appreciate you making sure to point that out. I'm really, really impressed by, what it is that you've been able to accomplish with Central Texas Allied Health Institute. I remember some of the early conversations that we had, when you were really working through getting it established. And it maybe probably doesn't to you because you've been, in the trenches, but it feels like you did that really quickly. It feels like, you were able to get the necessary support, and watching you fight to get the funding that you needed and get everything lined up to where you could really offer these opportunities to people. It's been nothing short of inspirational, to be honest with you. And I really hope that more folks, see that inspiration and see you doing what it is that you do. So often I talk about how much representation matters. And I think sometimes people just seeing you, do extraordinary things, it inspires them. So, in my mind's eye, there's a little brown girl or boy watching you and watching what you're accomplishing and how you are actually helping people. They're going to be inspired by that. So I'm curious, what was your motivation to, be in the space of training people in the healthcare field?
My own story. That was it.
Okay.
My own story. I didn't grow up a person of privilege, and I went through a long cancer fight with my father when he was alive. And I was in a position where I had to go to school and educate myself and help my family after he passed. So going into healthcare was the best decision I ever made. I've always had a stable job. I've always been able to provide for my family. And there's so many people that when they hear healthcare, they hear either doctor or nurse. There are so many other professions. I was a surgical technologist. There's so many professions that folks can get good jobs and they can work and they provide for their families. So that's really what my whole fight has been about, because I did teach at a for-profit small career college. And many of the folks that we work with now, I worked with back then, and it was so fulfilling to see them come out of poverty or sitting on poverty and get into the middle class and do the same thing that I did. And it's just been a testament to us because we've had so much help, particularly from the Michael and Susan Dell Foundation. They've really believed in what we're trying to do, and they have been a resilience trust. We're so proud to have all these folks behind us and really believing in what we're doing, because we want to change the world for folks. And so that little brown girl that sees me, I saw a little brown girl before me do it. So I'm happy to pay it forward.
Thank you so much for doing so. And I really appreciate that people are recognizing, the true asset that they have and what it is that you've been able to establish. And so they should get behind you and they should bring some of those resources to it, because this is something that we need to do. And, instead of just sitting around talking about how we need to do it, you did it. And that really just inspires me so much. And I wanted to bring you on and make sure folks know that this is an opportunity. Could you one more time tell us what that website is for them to be able to look up, some of the courses that are available? And one of the things that really piqued my attention is when you said you can enroll now. And this is, something that you can, in a relatively short amount of time, get your certification and be doing this work soon. So one more
Yes,
time.
our next class will be August 31st. So we'll have EKG, patient care technician, and a phlebotomy technician program. The website is ctahi.com.
And it's right there on the screen. Jerica, would you mind if sometimes we encourage folks to ask their questions in the comments section? Would you mind if I were to reach back out to you in a couple of days if there's some questions specifically for you? Do you mind if I just reach out and say, hey, there's some questions? You mind coming back to answer those?
Please do. I'm happy to.
Awesome. Thank you so much for joining us tonight. We're going to jump over to the mayor's state of the city. It was really a true pleasure, and I'm so proud to see you accomplish what you have, and so inspired. And I'm really, really looking forward to more members of our community being able to get into those really good positions of employment. That's fantastic. So thank you so much for all you do for our community.
All right. Thank you. Good
Have
night.
a good evening. I appreciate you joining us.
All right.
All right, folks, that's just about it. So remember, you can always find up-to-date information about questions, financial relief, and other important resources online at www.austintexas.gov/COVID-19. That's www.austintexas.gov/COVID-19. For now, it's time to sign off. Tonight's episode is Dr. Tasha. I encourage you all to switch over to www.austintexas.gov/ATXN to watch Mayor Steve Adler's State of the City address. That's www.austintexas.gov/ATXN. And until next week, where we'll see you right here for another episode of Talk with Tasha. In the meantime, I encourage everybody to stay safe, stay healthy, and where you're able, try to have some fun. Bye, everybody.